Chicago is known as one of the most segregated cities in America, with huge gaps between rich and poor and huge shifts in the quality of life that people live from one neighborhood to the next. All of that is bad enough. What it adds up to, though, is even worse. We board the L train not far from the million-dollar apartment of Lakeshore Drive. And even on a snowy day, we could see a change from the train window. In a journey of just 5 city miles, residents' lives are, on average, 20 years shorter than those just up the road. 87 years in what's known as the Loop, 67 here in West Garfield Park. That death gap, as it's known, is the largest of any big city in America. Dr. David Ansel.
Okay. Heart disease, cancer, homicide, overdoses, maternal infant health, and accidents.
And you add those up, you get a 20-year gap.
And walking into the Missionary Baptist Church here, Pastor Marshall Hatch says he's known about that gap for 30 years.
What is the failure?
Isolation, segregation from resource.
Crime, drug use, poverty all factor in, he says. And it means businesses like grocery stores and fitness centers have stayed away.
Well, why doesn't the government, the mayor, direct the police to sweep out all the drugs, sweep out all the guns, and then the money will come in and investment will flourish?
I mean, ultimately, what you want to do is not about sweeping out people, but it's about redeeming people.
For decades, Dr. Ansel says redemption for West Garfield Park has been delayed by a lack of interest and investment. Until now, his work with Rush Medical Center has led to the construction of a brand new wellness center.
The pastor was telling us that this is the first major investment in this community since the days of Martin Luther King Jr.
Yeah, it's shocking. This is one of the greatest shopping districts in Chicago. When he was assassinated, this neighborhood went up in flames, and there was no reinvestment.
Is it a government problem?
Yes.
It is.
Absolutely. We can't be a tale of two cities and be healthy and whole. And I think what we find out in communities like this, where some of the violence spills out, none of us are safe unless all of us are safe. And I think that's what we find out in a grand urban experiment like Chicago.
We are joined now by Chicago Mayor Brandon Johnson, a Democrat, a former social studies teacher here in Chicago, as well as a former member of the Cook County Board of Commissioners. Mayor Johnson's been in office since 2023. Hey, thank you very much for joining me.
Of course, thanks for having me, and Happy New Year.
Thank you very much. I appreciate it. So you just saw that piece. This problem of the life expectancy gap is decades old, long predates you. Why hasn't government been able to step in and fix it?
Well, first of all, it is a real problem, and we are working hard under my administration to address it. What is driving that life expectancy gap? It's homicides and it's drug overdose, right? We've reduced homicides this last year by 30%. We've reduced drug overdose by 34%, a total of 40% reduction since I've been in office. I'm confident as we continue to do the work that's necessary to invest in these communities, we can improve the quality of life for all of Chicagoans.
But you're someone who's lived here for your whole life. You live on the West Side now, and you're in public service. What is the explanation for residents who have known about this, as you just heard, for 30 years or more? You come along, you've got a plan. How come no one else fixed it already?
Well, part of the problem is we've had leadership that has focused on neighborhoods like the Loop. And we've seen that at every level, whether it's local, state, the federal level. And unfortunately, not enough attention in neighborhoods like West Garfield Park or Austin, where I live on the west side of Chicago, or on the south side in neighborhoods like Inglewood. But we have transformed essentially how we are approaching leadership in this moment by focusing our attention in the neighborhoods that need these critical investments, whether it's youth employment, of course, or whether it's education, whether it's health care, particularly mental health care. That's what my focus has been. And unfortunately, for a very long time, every level of government has focused on neighborhoods that, quite frankly, do not need the type of investments that West Garfield Park and neighborhoods like that across the country deserve.
What I learned from the doctor today there is that the quality of life that people are living in West Garfield Park historically contributes to the lower life expectancy. It's a harder life, more disease, and people die sooner. The lack of resources is a big part of that. But what comes first? You have to clear out the drugs and the crime, and then the investment comes, or does the investment come and that clear? You know what I mean?
Look, that's a great question. Look, it's a combination of both, right? Look, the neighborhoods that deserve investment in education, in healthcare, in housing. We have to do that now. But of course, we have to address, these, decades-old challenges that have been ignored for a very long time. And so that's why we have done, what the strategic partnership around policing and affordable housing, policing and youth employment, policing and mental health care services. By taking that full force of government approach, it allows for us to address the critical issue, the immediate need, while setting us up for long-term viability.
What was interesting is everyone I talked to today said, do you think we're finally at last at the beginning of the end of this problem? And people were not sure. The answer was yes. What's your answer?
Well, look, I believe we're obviously headed in the right direction. We have a little more work to do. It would be great if we had partners at the federal level. We know the Trump administration just cut $2 billion away from mental health care services. That's problematic. We're investing in mental health. So I believe that we are, at the beginning of a transformation, and I'm confident if we continue to come together, we'll see the type of life expectancy for all of Chicagoans that we can be proud of.
Mayor, thank you very much. I appreciate your time
Congratulations.
tonight.
And by the way, I think you would have had this job regardless of who won the election.
I appreciate your support.
You got it.
We'll be right back.